So good evening. I'm just making this short video on understanding that how we are going to maintain this KPI register, because all of you have been told to make this KPI register. So basically this KPI register has to be there in every ward. This KPI register has to be there in every ICU, it has to be there in every OT, it has to be there in the casualty, it has to be there in every laboratory also, in every radiology lab also. Okay, and then each lab, each ward, there are around 5 6 7 8 key performance indicators which you will have to note. So what you can do is you can dedicate kind of 10 pages for each key performance indicator. Like for in the ward, you can first section can be medication error. Everywhere you will have to write down patient's name, patient's UHID, date, time, when did this medication error happen, from whom did it happen, adverse drug reaction, again name, when did it happen, who reported it. So all those details of adverse drug reaction are already shared in the notice. Transfusion reaction, everywhere patient's name, UHID, date, time, when did this happen, who informed about this, what action was taken. So these are the columns you will have to make. Then again leave some pages. Catheter infection rate. Okay, so keep two 3 pages for this. Whichever patient gets a catheter infection, write his or her details. Everywhere again name, UHID, time, date, who reported, what action was taken. Central line infection, surgical site infection, especially in the surgery wards. After surgery, if the site is infected, so leave some pages and put for that. Then discharge time. This is for every ward, that from the point we give discharge till the point the patient leaves the ward, how much time does it take. So just on average, once in a week you calculate, keep a data of that this week the discharge time was this much. Needle stick injury happening in OT, happening in OPD, in the wards, you have to keep who was the employee whose needle stick injury took place. In OT, you will have to keep a register where unplanned return to OT, where a patient was operated and again 2 days he was brought back to OT, unplanned. Okay, so he was operated already, but unplanned he came back for some emergency. So you have to note this in a section called as unplanned return of the patient. Wrong procedure done on wrong hand, on the wrong side, on the wrong patient, you will have to notify. That will be one more section. One more section in OT will be transfusion reaction. Rescheduling of surgeries. This, like patient was scheduled to get operated on 16th July, but again was rescheduled to 20th July. So there should be one section where how many surgeries were rescheduled. So again that has to be written. In ICU, mortality rate. Again return to ICU. The patient has got discharged, gone to the general ward and again returned. So all those cases you will have to write down. Ventilator related pneumonia, how many of them got pneumonia due to ventilation. Again central line infection, nurse to patient ratio has to be written in one section. In casualty, there are some sections like return to casualty, so within 72 hours. So some patient came to us, he had some stomach pain, we thought it is acidity, or he had some heart pain, heartburn, we thought it is acidity, and after within 72 hours he comes with a heart attack. So all those cases where same patient has returned to casualty within 72 hours, so there should be one section for that. So basically keep the register ready, and we'll have a detailed session again on this Friday 12 to 1 in Florence Nightingale Hall in the nurses auditorium. So watch that also, and again you can make fine changes in your register. But main thing is you have to keep your register ready by Thursday evening and make sections in this as I have told. Again go through the document which has been sent to you, and try to keep 10 pages for each section. Like in wards, for ward there will be one section for adverse drug reaction, another section for medication error, another 10 pages for transfusion reaction, another for catheter related infection, another for 10 pages for central line infection, another 10 pages. For surgical site infection, another 10 pages. For how much time it is taking for discharge on an average, another section. For needle stick injury, another section. For handover, how whether there were some errors in handovering the charge from the nurses. In OT, one section. For unplanned return to OT after 10 pages, another section. For any wrong procedure done on a wrong patient on the wrong side, another section of 10 pages. Any transfusion reaction, another section of 20 pages. For rescheduling of surgery, how many times the surgery gets rescheduled. In ICU, one section. For mortality rate, how many people are dying on average every day. Another section for 10 pages. For return to ICU, patient discharge from ICU again comes back. Ventilator related pneumonia, how many patients got. So all details of those patients, again date, time, everything has to be noted. Central line infection happened in how many. Nurse patient ratio. In casualty, there will be the main register in the casualty will be return to casualty within 72 hours. So this is just tips. Again, see you on Friday at 12 noon at Florence Nightingale Hall, where we'll discuss more details on how to maintain this register, how to calculate the key performance indicator, and how to report it, how to compile the data. Thank you so much.